maybe in your minority mental health update?
Yeah, and because the information that preceded me, in order for me to stay on track, I need to go with my slide. And the reason I say that is because mental health is interconnected with everything. So I have a conversation for each doctor that went before me about the struggles and the challenges, especially that Black people deal with. So I'm gonna tell you a little bit about me, and I'm go through my journey, and then I'm gonna talk about the history of psychology in the mental health field, where we are currently, and what we need to do to move forward. So my name is Tania. I am a psychologist. Currently, I am working at the Cleveland VA, but I also am the CEO and founder of Kindred Spirit Behavioral Health, which is a community mental health agency in Akron, Ohio, that specializes specifically in African-centered therapy and counseling services for Black folks. Also, in the field, I represent the Association of Black Psychologists, where I sit on the national board. And I just want to just kind of give a little history there, because it's very important as it relates to where we are and where we're going. And we heard similar stories from other panelists this afternoon. ABPSY, the Association of Black Psychologists, it exists because of the disparities and the different treatment approaches and recommendations that our people have been experiencing. And the reason that we focus on Black folks, because unfortunately, the outcomes for Black people are the worst. When you look at every other ethnic group, every other background, the outcomes for African Americans in particular are the worst. And so in the field, when we go to school and we get trained and we get certified and we do our clinical residencies and postdocs and et cetera, we are trained in the field to work from approaches that were developed for white people by white people. And these theories, in terms of how we understand what we're presenting with, what are these concerns that we're walking into these spaces with, are developed based on what white people think and what white people feel. And so Black psychologists got together, especially during the civil rights movement, and said, wait a minute, our people are experiencing racism, various forms of oppression. There's transgenerational trauma that stems from enslavement, that stems from Jim Crow era, where we have internalized these messages that Black people are inferior. And unfortunately, we see that in our interactions and our behaviors. And again, when we hear all the medical disparities, it stems from that. And so making sure that we understand and have context allows us to be able to intervene and promote healing that's going to be conducive to the cultural and lived experience of Black people. So ABPSY is the vehicle where a lot of training and support and healing happens that is specific to the experiences of Black people and healing that is going to promote our overall growth and health. So let me go ahead and just highlight some of the mental health disparities. Again, they're systemic and very complex. When we think about the racial, ethnic, and gender and sexual minority groups, again, the rate at which they experience mental health is very pronounced and prevalent, but when you look at those outcomes, because of the environment or because some of the approaches that are available, those outcomes are very poor. The poor mental health outcomes are often due to factors that deal with inaccessibility, cultural stigma, discrimination and racism, and overall lack of awareness about mental health. So going back to my earlier point, therapists, psychologists, social workers, those people who are in clinical practice trying to understand what people are dealing with, have been trained in Western approaches. Again, these approaches are developed for white upper class, middle class individuals by upper white class. So even when you think about those cultural experiences or the framework as it relates to how they see mental health, how they see behavioral health, it becomes a challenge. And not that there's anything wrong with those theories or approaches, but we have to be careful. Those approaches are designed and intended for white, upper class, middle class people. They're assumed to be universal, however, that they're not. And the reason that we know that is because it's well documented in the literature that these westernized approaches neglect cultural background and our lived experiences. Black people in particular are over pathologized. What I mean by that is we are more likely to receive a diagnosis that is not consistent with what we experience. Over at the VA, I work with all the Black male veterans that come in there. And the majority of the time they come in and they have been diagnosed with a psychotic disorder, schizophrenia, antisocial personality disorder. But when you look at the context, you'll see that they more likely suffer from trauma, PTSD. But we don't see PTSD and trauma in the Black community, but it's reasonable given all the trauma that's happening across the country and that's being televised all over social media platforms. You will think that we will see more diagnosis of stress, depression, anxiety, and trauma. But for Black folks, we don't see that. We see things that have poor outcomes and have negative implications. So when individuals are diagnosed with things like psychotic disorder, schizophrenia, the first line of treatment for that is medication. When they refuse to take the medication, now they're labeled and considered resistant. And now, you know, things such as they're involved in other systems like the legal system or children's services board. Now they have to deal with consequences of not following treatment plans or case plans. So how we diagnose and understand the experiences that Black folks are dealing with is super important. Using westernized approaches, unfortunately, results in over-pathologizing Black people. Then we receive less preferred treatment again. For some of those diagnoses, medication is the first line of treatment. But if people are not organically experiencing psychosis because of how their religious or spiritual practices are, or maybe they are a little paranoid and concerned given the climate of the country and the social unrest that we've all been experiencing, then they're going to be less likely to take medication. Medication is not going to help that. Premature termination. When we do engage in therapy, we terminate by the second session. And that is because of cultural mistrust, a lack of connection, a lack of understanding with the provider. But what we heard earlier is what we do is we overutilize the emergency room. So Black people go to therapy, they don't go to therapy, but they will go to the emergency room if they're having panic attacks or very high anxiety or things of that nature, and then they go home. So we overutilize the ER and we underutilize mental health services. So these are just some statistics. People from racial and ethnic minority groups are less likely to receive mental health care. Among adults with any mental illness, 48% of whites receive mental health services compared to 31% of Blacks and Hispanics and 22% of Asians. Although rates of depression are lower in Blacks and Hispanics than in whites, depression in Blacks and Hispanics is likely to be more persistent. The rate of mental illness in African Americans specifically are similar with those of the general population. However, for African Americans, they receive poor quality of care and experience a lack of access to culturally competent care. Disparities as it relates specifically to depression is something that I just really want to highlight, because again, when you think about the experiences, the life experiences, the lived experiences, just what's going on collectively across the country, you would expect to see a high rate of depression. Even when you just think about what happened with COVID. The pandemic highlighted what most of us probably already knew, but the rate at which Black people contracted COVID and the rate at which Black people died from COVID was 3 times more higher than their counterparts. And why is that? When we think about the preconditions that we have, when we think about poverty and the impact of that, when we think about environmental stress and the impact of that, of course we would see depression. But depression is the least likely thing that's diagnosed with Black people. Of course, depression and anxiety and trauma is things that you want to see. And it appears to be more consistent with what it is that we are experiencing, but we are the least likely to receive that diagnosis and the proper care for that. So survey findings show that Black and Hispanic respondents are more likely to seek information on mental health outside of the healthcare system, and they prefer providers with similar life experiences and greater stigma about mental illness. These are the barriers. So when we have different cultural perceptions about mental illness and well-being, Black people are not going to be open or responsive or even seek mental health therapy. We have to begin to understand the impact that racism and discrimination is having on mental health and how that is actually exacerbating symptoms. We must understand how being more vulnerable to not having insurance or proper insurance to cover some of the care that is required, the cultural differences in help-seeking behavior, language and other communication barriers, a fear and mistrust of treatment, and then the evidence-based movement. So I want to talk a little bit about the evidence-based movement because that's the current state in where we are. And so there's a movement that, and it's being televised, it's commercials, and it's all through social media, where people are being encouraged to ask their providers, what evidence-based approach are you using? And so people are actually being discouraged to see providers if they're not using evidence-based approaches. So let me say something about the evidence-based approaches as it relates to mental health. These evidence-based approaches, these clinical trials that were done, does not include Black people. So again, the research does not include how Black people are doing with these particular modalities. Again, they are more consistent and helpful for white people. And so when people are hearing or challenging their therapists who are using more culturally specific practices, healing strategies, and et cetera, that is not evidence-based practice, so it's not credible, then that creates confusion and it creates a place where people are not going to feel comfortable with seeking out therapy. So the evidence-based movement is happening now. There's a lot of research that talks about these approaches work best for anxiety. These approaches work best for depression. These approaches work best for psychosis. About a diagnosis, it says nothing about the person and the person's lived experiences. And because of that, they are significantly limited as it relates to African Americans. Evidence-based approaches, African Americans actually do worse with those approaches. So that's the current state. Also, when we think about the persistent trauma that everyone has experienced, when you think about the hate crimes that happen, when you think about, I'm from Cleveland, born and raised, but I live in Akron right now, and our city is dealing with what happened with Jaylen Walker. The city is going crazy. Not only is the city going crazy, but what happened weeks before, they already started shutting down the city, shutting down schools. Before the verdict even came out, they already shut things down and basically boarded up downtown, all the buildings. What we have to understand is when people see this, we internalize these things, whether we want to or not, but we internalize it. And what we internalize is, wow, Black people are inferior. Wow, Black people are unworthy. Wow, Black people are no good. This is what we internalize, and internalizing that is where we see the depression, anxiety, the community violence, the domestic violence, the substance abuse, the addiction. All of that is really representative of internalized racism. And if we don't have treatment approaches that really target and address or understand like these experiences and how it's showing up in mental health, then unfortunately, we're going to continue to see very poor outcomes for African Americans. The pandemic highlighted a lot of that. The good thing that came with the pandemic is that they have approved telehealth. So we have been able to increase access. So people are able to, call or talk, sometimes even text or even have a virtual visit with a therapist. And the research behind that said it's been helpful, and it's probably have been more helpful than going into a traditional office and having a face-to-face session with a provider. So in terms of future directions, it is super important that the assessment and treatment process that we have is culturally conducive and consistent with the people we're working with. Oftentimes we hear like, well, there's no research. It is. What are you researching? Because if you research what works for a particular diagnosis or a particular situation, then you're going to get research that gives you that information. But if you want to know something specifically about what's going to be helpful for Black people or a particular population, then you research that population. Focusing on the actual therapy approach and some of these things is what ends up leading to a lack of knowledge and information that can be more helpful. We also want to increase access via telehealth. Education and training, I think, is super important. Here's what I mean. As a mental health provider, we are all licensed, and every 2 years, we have to complete continuing education. For us specifically, when we do continuing ed, we are mandated. It doesn't matter how you get your 30 hours, but you must have at least 3 hours in ethics, and you must have at least 3 hours in supervision if you're supervising. How come it is not mandated that you have at least 3, maybe even 6 hours of culturally competent care? It's not mandated. And because it's not mandated, people are not going to follow through with it. Usually when I get called out and I'm doing some kind of professional development, or I'm talking about, the mental health state of Black people, the training is offered during lunch. People not giving up their lunch hour to go hear about this, or is not mandated in companies, right? So if it's not mandated, people are less likely to participate. So we have to start mandating for licensure purposes. We talk about being ethical people, but you can't be ethical if you're not providing culturally competent care that's going to improve outcomes versus making outcomes worse. So that's what I got to say about the state of mental health.
Thank you, Dr. Johnson. Now we will have